Looking after a complication from a cost point of view is always a source of distress. So the patient often rightly feels that they should pay nothing. In reality, the surgeon doesn't have control over all the costs incurred, and there's no model by which you can really charge patients up front or insure them against complications. My own policy is that I don't charge patients to look after a complication. You're not getting a bill from me to care for a complication, even if it involves multiple surgery and however long it goes for. However, so therefore, if the patient doesn't need to go back to hospital, if it's an infection or something that we can treat in the office under local anaesthetic to fix, there's really no charge at all. If the patient needs to go to hospital, if the patient needs to have another anaesthetic, then typically there are costs incurred, and the cost will be the cost of whatever the hospital will charge and whatever the anaesthetist will charge. And we try and minimise those as best as possible, but got to face the facts that there are costs in complication care. Health insurance in complications is some complications, particularly if the procedure is not purely cosmetic, then the costs are essentially covered by health cover. But if the procedure has been a purely cosmetic procedure, then the health insurance company is unlikely to cover costs of complication or hospital admission. And again, these things we disclose to patients have got to be known as part of the planning. How often does this occur, that a patient's got to go back to theatre at their own cost? It would be well less than 1% as a risk. It's an uncommon thing.